All right, good afternoon. Let's get this party started. I am on your landing page for week 3. Welcome to week 3. So as you see here, I'm also in student view, and you have the previous 5 announcements up. So let's go through and take a look at those. Not all 5 of them, but let's do welcome to week 3. And in here, it will usually tell you what the plan is for the week. And so here is your invitation to today's Zoom meeting. I thought I would try a different time since students aren't able to attend on Monday evening. So I thought I would try in the afternoon. So we'll see if that works better for people. And then I also included the link to go ahead and make an appointment on my calendar. I would suggest this for students who have a 70% or less in the class right now. I'm more than happy to give you suggestions, help you, explain things, walk through things with you. So please take advantage of that time. That is Monday afternoons or Thursday evenings. If those times don't work for you, then please message me, email me, and we can set up another time outside of those times to Zoom and work and see what's going on and how I can help facilitate your learning, because there is a lot of information and a lot of work to do as this is the summer class. I am still compiling the data for your accomplishments for week 2, which you had quite a few working on those assignments and learning about things. And so then it goes into welcome to week 3 and the things that we will be working on this week. So if you don't have your notifications set, I would highly recommend that you do so that you see these announcements. I generally also post an announcement when this video is ready to be viewed. And I usually would do some midweek, either on Wednesday or Thursday, check-in reminder type of announcement. So keep a lookout for those. That's how I communicate in this online course. So this week we are going to talk about mapping health inequities and measuring justice, which I think is really important. And so we're actually looking at data and statistics. How do we measure all these things that we've been talking about so far? So we talked about, let's go to the modules for a minute so we can kind of do a quick recap of what you have accomplished and learned about so far. And let's see, view a student. There we go. And so in week 1, that was the introduction. And we talked about health and social justice. We talked about social determinants of health a little bit. We got to know each other. Sorry, I got to grab my coffee. And the assignments, we also learned about understanding and using credible resources. If you looked at that particular lesson, that will be helpful as you progress through the course as well, as it talks about how to do references and how to decide if something is in fact a credible resource. And especially in this week 3, that's going to come in very handy. So you did a free write about what your thoughts and understanding was of health disparities, health equity, and social determinants of health. And then you also shared, most of you on the Padlet, about any personal or community health experiences with disparities or inequities. And you tied that into the social determinants of health to choose a social determinant of health. So this was sort of an overview. What do y'all think of disparities, health disparities? What have you seen? What are you experiencing? What is your experience? And also a little bit thinking about how these disparities, inequities are occurring and how might we be able to help decrease those inequities, hopefully fix them. That would be nice. And then in week 2, let me close this one. And then in week 2, we really dove into the social determinants of health and Healthy People 2030, looking at social determinants. We also looked at structural determinants in terms of government policies, procedures, things that, again, are determining our health. What are these factors that play into that? And you had some supplemental articles to read. You also talked about, you did a case study, which I'm still grading those, looking at any particular local structural barriers that you see in the local area, in your particular local area. If you're not in Salinas, wherever you are living, you also got to choose to watch one of the unnatural causes videos that talked about different types of inequities and things that might be able to happen to mitigate those. And then you also, which I've looked through several, but not all yet, sorry, of the discussion on how structural and government factors shape health outcomes. So we're really looking at the causes. Like, what are we seeing? What might the potential causes be? Why are these things happening? Why are we in the space predicament that we find ourselves? So now in week 3, which is open, I'm opening one module per week. I may end up doing one more, but I want people to really focus on what the week is and then move forward. So this week we've looked at all those factors, but now what about the data? What is data telling us? What data do we look at in public health? Why is it important? What sources do we look at? How do we map those? How do we look at those? And so this week, that's what the overview is. You've got a lesson on measuring social justice and public health, which are things that we have actually started doing already. We're kind of looking at putting it into more of a numeric or visual context so that we can see. It's not just, oh, well, so-and-so said that this is a problem. So-and-so said that was a problem. We can actually look. There is data per county, actually, per zip code, that tells you what the average ethnicity, or not average, what the ethnic makeup is of the community, what the average age, the average income, education, those types of things. And then we talk a little bit about epidemiology, which is in public health. Hopefully, if you took the Introduction to Public Health course, you talked about epidemiology. There's a fun little game if you want to play that on your own. It's called Solve the Outbreak. What's interesting about this, I think I can actually take you, excuse me, let's go play with it for a minute. It takes you to this website, you click on Solve the Outbreak, and I will explain to you the reason that I have it, in here. Let me turn that down. Actually, I think what we'll do is settings. That will, sorry about that. Yikes. I always forget that it plays that cool music. And so you are going to solve the outbreak. And so you start with level 1 and just take a look at 1. It's, whatever it is, whatever you want it to be. It gives you a bunch of different little mini case studies. And so you can look through and see, which one you like. I like, which one did we do? I think we did, let's see, I think I did this one, Laid Low in the Desert. This one's in the United States. They do have ones that are in multiple states, or for example, this one is in Kenya. We will talk about globalized public health later on in a few weeks. You hit continue. And basically it's giving you a case study. Oh, oops, clue 3 of 5. Let me go back to the beginning. So what it tells you, gives you this little backstory. There's a 9-year-old boy, got a fever, ended up with a rash, and it tells you, it gives you the cases. So what it tells you is that he's not the only one that was ill. What it does is it's actually quantifying the data for you. When they did research about what was going on, they found that everybody had a headache. Some people had chills. Everybody had a high fever. Some people had chills. Some people had a headache. So it's quantifying the data. So we take that information And then it asks you a question, and you answer the question, and then it will give you the next clue. And so 3 more people have gotten sick. And so you now knew that you needed to ask people where they were, what they had been doing. So you click on the data and it gives you more information. And so it tells you that 80% of the people have a dog or spend time outdoors, and 48% of the people regularly play outdoors. And then there's more data there. So that data is giving us this little idea in our head, might have to do with people being outside. So it asks us another question. They're getting sick from something outside. And so they work outdoors. We figured that out. So now more people are starting to get a rash. And so you can click on the cases and it will tell you, again, looking at the data, looking how to graph data, the number of people, it looks like number of people who participated in an outdoor activity, 10 of them that got sick were bitten by a tick. So that's 100%. So if people are being bitten by a tick, that can lead us down a certain path. And then this will talk about an attack rate. You don't need to know that. But again, it's looking at the data. How does that data look? And so then it will ask you more questions. Give patients medicine, close the pool, perform tests looking for radiation or other problems in the environment. I'm guessing we'll go with that. And then it tells you, yes, you earn points for this. I think it's kind of cute. But anyway, the reason for it is to look at data. How does the data look and what do we do then with that data? Okay, let me go back. I don't know why that did not open in a different window. I'll have to take a look at that. Maybe I can set that setting. Nope, there we go. Okay. So go back to the module. Actually, let me go back. Nope, we were in module 3. So, and then it talks a little bit about biostatistics. What do the numbers actually mean? And then it actually gives you some another couple links to go look at how to use and handle data. It talks about indexes, probabilities, graphs, what is data? What does it look like? Different ways that you can show data, right? Because you've seen data where it's like a bar graph where it's bars, or maybe it's points and it's got a line going across the page. There's different ways to do that. And then there's also showing you data visualization. Again, if you click on this, it will take you actually to the website. And so this was actually updated in 2024. It will have statistics depending, you have to look. So we're going to talk about mortality being death statistics, morbidity being illness statistics. So this is a place that you can look that up. Leading causes of death. Now that only goes to 2017. There are other sites that you can look at that will give you more current data. And then there's also, what else did I throw in there? This particular one, looking at, now this is the CDC, so Centers for Disease Control, and this is for health sciences. And this is talking about statistics, right? So chronic conditions, falls. Here's latest data and analysis. Fetal mortality. We know through science and investigation that African American women receive care that is of less quality than Caucasian mothers. And so also the fetal mortality rates increase as a result. So you can actually look at the statistics, all kinds of stuff in there. And again, this is just to look at. There aren't, there's not a quiz on this, but there are 2 assignments that you need to do. So you need to know where the resources are to look up the information that you need to have a fact and data-based statement. We can say, African American women who are receiving prenatal care receive a poorer quality of care. We could just say that. But what data do we have to back that up? That's where we go back and look at all these sites and look at the statistics, and we can look at maternal mortality. how many moms die, fetal mortality, how many babies die. We can look at mortality and then also morbidity. So how many moms have chronic illnesses or acute illnesses as a result, and the same with the babies. And so that's kind of what this week is about. Where do we get the data to make the statements that you've been making, the things that you've been realizing when you're looking in your neighborhoods and watching those videos? But how do we know? And once we know the reasons, we know the numbers, how many cases, we can go then and look at why this is happening and then look at potential causes. Many of you are asking questions about how can I advocate? How can we change this? How do we make a difference? And those are the things that we will start looking at as we move forward in the next few weeks. So you have your social justice journal again, and people are doing well with that. Just remember with the journals to answer all the prompts, answer the key concepts for the week. That makes it kind of like a study guide, which is a nice resource for you to go back in time if you need to, and include links or pictures that will help you recall what you've learned each week. So you will do research, choose a current public health issue. There's another one, I think it's in week 7. So this is the first one. That'll be the second one. Research a current public health issue. I'll go into that in a minute. And also there's a health inequity infographic. It's not really a project. It says project. I should take that out. Health inequity infographic. So you are going to develop your own way, your own picture, if you will, of what the data that you've researched looks like. So let's go look at the overview. And kind of went tropical. Thought maybe that would make people feel good. And so we, in this week, are looking at course objectives 4 and 9 because everything relates back to some objective, course objective and an objective for the week. And so most of the weekly objectives have to do with data. So in identifying and interpreting key health metrics. So we just talked about morbidity and mortality. So life expectancy is another thing that we can look at. And so that's what helps us assess the disparities, and we can look at it against different populations, different ages, education levels, ethnicities, male, female, other. We're also going to analyze publicly available health data sets like the CDC that I just showed you. There's a couple other really good ones. We can look at geography, race, gender, socioeconomic status. And then evaluate how data visualization tools communicate this information and influence us on making our public health decisions. So if I look at a map or a graph, what does that information tell me? What do I infer about what's going on in that community? And then what decisions do I make as a healthcare professional? What decisions can I help influence? Can I write a congressman? Can I write to the state? Can I write somebody? Can I have a peaceful protest? What are things that we can do to help influence public health decisions in those structural determinants? Also using credible sources to research a current public health issue. Right? So that's your choice. Whatever issue you would like to review is great. And then thinking about reflecting on how these mapping and measurement tools support advocacy and policy decisions and interventions. So they all kind of tie together. This is making it a little more factual so you understand what the data means in terms of social justice. And so that's what we're doing. We're looking at tools to help us understand the disparities and inequities. And so the key concepts, remember in your journal, there is the top part of each week that says key concepts. So what you need to do is to summarize these, like a study guide in your journal. Anything added in pink, kind of looks red, but it's supposed to be pink, dark pink, means that I have added it. And so it won't be in the journal. You have to add this into your journal. So tools to assess health disparities and data interpretation. And then it's going to talk about the different metrics that we're looking at, how to tell the story with these pictures, and then looking at geographic distributions of health disparities. And so these are your readings. This particular textbook this is that download. You probably have it from last week. It does take a while to download because it's a 500-page book. And so epidemiology is the study of disease and death and injury in the community. So that's what this particular chapter, is about. And then in Schneider's Introduction to Public Health, this talks about statistics and the role of data in public health. So those are good background, excuse me, too much coffee, background information on that. Then you can go to the CDC health rankings, which I can add the link there. It's in one of the assignments. And then these are those, the open educational resource books that you have. So these again talk about the research methods, types of research studies, and then helping you pull it together to do the research analysis and with the data, how to map the data. And so then for your journal, I'm going to skip assignments for just 1 second here. I added another question. What information does data reveal when identifying public health inequities? So these are the 3 questions for your journal this week. So let us look at the assignment so you know what you need to do for this week. So first of all, they probably seem to overlap. And that is probably the best way to think of these 2 assignments, although you do not have to. If you research a current public health issue and then want to do your infographic about that particular health issue, that would probably make the most sense. But you do not have to. You could choose 2 totally separate ideas, or you could look at different aspects of a public health issue. So let's look at the current public health issue, researching that number 1, right? And so this is due next Sunday. It's worth 15 points. And you're going to research a current public health issue using those credible information resources. So there's the course objective, the weekly objectives that are tied to this assignment. So you understand that these assignments are linked to the objectives. And then here's what you do. You want to choose a current public health issue that involves some type of health disparity. It gives you some examples here like asthma, maternal mortality, access to insulin, food insecurity, housing and health. And then there could be local issues that might pertain, particularly in our county, to pesticide exposure, lack of mental health services, food insecurities, housing instability, decreased access to women's health care, those types of things. And so your task, what you need to do is research the issue and summarize. Now, it doesn't have to be an issue that we just talked about in that paragraph. It'd be something else that you feel is important, something that you are passionate about, that is fine. So make sure you look at the rubric, which we will do. I think it's helpful. It's helpful for me anyway, if you actually kind of go through the steps that are laid out for what you need to do and put little headings, because then I know that you know what you're supposed to do for the assignment. And so the health issue, what is the health issue? Who is affected? What makes it a disparity? So if we took, I don't know, maybe access to insulin, I would say, or other potentially type 2 diabetes medications. And so what is the issue? Or you know what, let's actually take access to healthcare, because many of you spoke about that. That's one of the things that's really hit home for you in the class, right? So the health issue is limited access to quality healthcare. And so you might be able to, in your community, pinpoint that to something a little more specific, but that would be an overall idea. And so that's your issue. Who's affected? Many of your families, many of you personally have been affected by that. Is it a particular ethnic group, racial group, income group, education group, gender group who are affected? And what makes it a disparity? Why is it a disparity? Why do some people have great access and it's quality care and others don't? And then contributing social or structural factors, right? So that'd be your social or structural determinants or anything else that you think is a factor that's contributing to this disparity. So those are just, again, some options. Then what you want to do is, here comes the data and the research part, which is what the point of this week is. So you need to use at least 2 credible sources. So any of these that I'm giving you, anything, you're welcome to go to the Hartnell Library and look up in the databases there in EBSCOhost, CINAHL, using the resources below. You can go back to that week 1 to the credible resources lesson and look there. That will walk you kind of through how to utilize the library as well. And so these different sources give you information. The Data USA, a lot of the students in nursing will do that because it gives you some pretty good information about, now again, this is Monterey County, but the median age, employment, how many people are employed, tells you a little bit about the county, and then it goes into population diversity, talks about race and ethnicity, gives you a lot of infographics there to look at. So that's a good site. So any of these other sites, you guys can look at those and see which serves you. You can look up articles, you can look up credible web sources, you can go and get specific numbers if you wanted to look at maternal deaths related to poor quality care. You could type that in and see what pulls up for sources. And so you're going to research and you're going to lay out what sources you used, what information you found, what is the current data. So you've said, oh, access is a problem. These are the people that are affected. These are the factors that shape this particular outcome. And here's the evidence now that I have found that supports what I said. So you could look at, there are some of the resources here. I forget which one it is. This is health data. Let's try that one. The health department. So it will give you, here's birth and perinatal health. So let's go there, for example. And it will tell you how many live births, how many teen births, fertility rates, and going into birth data among mothers with late entry or no prenatal care. So how many in each racial or ethnic group. So for example, if you're talking about access, right? So this is Monterey County moms with late entry, so late prenatal care or no prenatal care in 2023. So that would be an access, potentially an access issue. And so if you look at Hispanic or Latino, any race that has to do with that, 4% of that group, 161 births, received late or no prenatal care. That tells you something. White non-Hispanic, 18. So that might also tell you something. And then other non-Hispanic and unknown didn't tell, perhaps multiple races or ethnicities. And so that gives you information and you look at that and you go, oh, okay, well, let me look at education rate, without a high school degree, or then you can look at these other factors and kind of layer them on each other. So that's just an example. Let's go to that. And so then what might some solutions or public health responses be? Are there programs, policies, or advocacy efforts in progress? So for example, this Natividad, there's a Monterey County Health Needs Collaborative. So that might be something to look at and see, well, what are they doing? Can I join that? Is that something that I can help? You could look up any California legislature, Monterey County legislature, having to do with health outcomes. And there's different sites. If I can find the site that I'm thinking of, I can add it here. That will actually tell you what bills are in the process of going through House and Senate at the federal and the state level. So sometimes that's something. Now, this isn't just what programs or policies or efforts are in progress. Is there something else that could be done? Is there something at a grassroots level, something that we all could do in the hospital, in the county, in that county health department, things like that? And then the last part is your reflection. So why does it matter to you or your community? Why are you looking at this particular public health issue? If we go back up to the top, it's a public health issue. Why is it important to you? Does it affect you? Does it affect those you love? Why is it important? And what do you think can be done about it? Now, the fun thing, maybe not fun for you, but fun for me, is that you are able to format this in any way that you would like. You can do a typed report, like a 1 to 2 page report. You can do it as a slide presentation. You can go to Canva. I love Canva. You could potentially, like I'm doing here, recording this video. You could do a video summary, maybe 5 minutes. What says 3 to 4, 5, depending, as long as you're meeting and answering all 5 of these questions. And then there's your rubric. It is worth 15 points. When you're looking at a rubric, always look at which parts have the most points assigned, because that means that's sort of the most important part, or the part that I'll be looking at to see, did you guys get it? Did you understand what I was asking for? Hopefully. And then were you able to answer it? So insight into the relevance of the issue, any potential programs, any things that you want to do. Do you have at least, so for the full points here, it says uses 2 plus. So 2 plus would be 3 or more, because it says at least 2, right? And so, so there's that. So I need to change that. That should be 2 plus, that should be 2, and that should be 1 or sources. But that's what the more sources that you look at, the more data that you gather, the more information you get, the more informed you are, the more you can make a difference. All right, so that is that assignment. Now, the assignment that goes along with that is the infographic assignment. So let's take a look at that. So again, 15 points, creating an infographic using health disparity data. So you just researched, I mean, you can do it in either order, but you just researched this current public health issue. What data did you find? Maybe use it for this assignment. So these are, again, the objectives that are tied to this particular assignment. And so for this assignment, you're creating a visual project, a visual, not product, a visual product, I guess we could say, end product. You will be trying to think about it that you are trying to teach someone new about the issue. You are trying to educate them about what is going on in this, and this is the data, the information that you have that explains the issue. And why does it matter for social justice and health equity? And making sure that you're using real recent data and research from credible sources. So think about, I need to teach, this person doesn't know about maternal mortality based on no or late prenatal care, something like that, which has to do with access to health care. And so pick a health equity topic. You can choose from the readings. There could be something from your community, United States, could be based on your public health issue, and then credible sources. Again, like you have that list that you can look at, and then you want to create a visual. So it could be like a Google slide. It could be 1 or 2. It doesn't have to just be one picture. But it could kind of like a I guess like a flyer. You know, if you're making a flyer to hand out, not a pamphlet, because a pamphlet is more than 1 page, but it'd be like a 1 page info sheet that has pictures on it, or graphs, data information on it. And you want to have 3 to 5 key facts or statistics. Did you know that in Monterey County, 4% of the women that receive no or late prenatal care are Hispanic, or something like that. And then you want to add in those charts, those pie charts that come in different colors, or a bar graph, could be pictures. And you want to make sure that you have a source for every statistic or quote that you are taking from this source. And you want to be clean, organized, and readable, but not too much text. So this also speaks to people maybe who speak a different language. So pictures are very good for those types of descriptions. And also people that might not know how to read, which happens. There are some indigenous Mexican Hispanic dialects that are it's not a read language, it's a verbal language. So showing pictures with information would be very helpful. Ideas, things that you can use. You could use Canva, Google Slides. I've not tried PictoChart, but I hear it's pretty good. There's a free version if you wanted to do that. And then save it as a PDF or an image file, a PNG. You could do Google Slides. You could download it from Canva. And then there are some ideas for topics. Again, these can go back to the public health issue. So Black maternal mortality, asthma rates, nutrition access, LGBTQ mental health disparities, outcomes by zip code. If you're out in your community, what's going on in your community? Have you walked outside and looked at your community in terms of the social determinants of health? Impact of climate change, language barriers and healthcare access, things like that. Those are just ideas in case you need some ideas. And then less text, more visuals. These are the tips. You want clarity, not a lot of color, which I don't do well on at all because I love color. And then make sure that the data is up to date and reliable. And then your rubric, so 15 points. And so making the connection to health equity is worth the most points in this relevant current topic. And then the design and organization. Those are the three components to that. And that's worth 15 points. And both of those are due on the 29th, which is next Sunday. So let us go back to the home page. And so those again are the announcements. So if you missed an announcement, if you need to know where the recording for the week 2 walkthrough is, I will post an announcement for the week 3 walkthrough and add it to this page here. You also have on your to-do list, it will tell you, this is from June 9th. So these are announcements. So those will show up here on the side as well. Any assignments that you've yet to do. Are there? Boy, lots of announcements. There we go. Okay. And this will again take you back to the module. And we looked through all that. We talked about that. We went over the reading. We talked about the assignments and the journal. I think I have covered that. Let me go one more place and look at, I think this particular page is a good one to kind of help, again, bring everything together for the past 2 weeks and this week currently. So how do we measure social justice in public health? This is health and social justice, right? Looking at disparities and inequities. And so social justice, you guys have already defined social justice, health inequities, health disparities. And so how we do that, we look at health outcomes. We talked about life expectancy, mortality, morbidity. Morbidity would be illness. We look at that. This is the a health atlas that will help you. I think it should. Nope, I will make sure that link works. And so Latinx residents have higher rates of obesity and diabetes. So if you go to the link, it should be able to give you that information so that you can look at it and see, oh, that is true. We also look at social determinants. We measure social determinants. So systems that shape daily lives, right? So how do we measure it? That was part of Healthy People 2030, going in and looking at statistics there. These are different, oh, see, those work. The other one doesn't. Oops, nope. Okay, I will check. Oh, I bet it's because I'm in student view, but I will go back and check and make sure that they work. Because it shouldn't matter that I'm in. Yep, that one works. All right, I will go check the other link, this one. We also measure it through policies and structural determinants. So city health, right? You can put in your city or state and it will give you information. And so think about, as you're looking at these, as you're preparing for these assignments, how would you measure whether justice is being achieved in your community? That's kind of the question. You have to tell somebody that's new to your community why this public health issue is important to you, and is justice being achieved in your community. So to recap, we are measuring the health outcomes, the social conditions, and the systemic structural conditions. And so it's not just about poor outcomes, it's about how the outcomes are shaped by policies, environments, and power. So we know we have poor outcomes. You guys have shared those, but how they're shaped, what's happening to make them happen, and then how can we advocate to make things better? Let me see if this one works. This might be the one that I was, yeah, so you can put in your zip code. If we do 93901, it should give us Monterey, California. And we go and it will give you all kinds of the demographics. There's the county. You can look at other counties. It'll show the demographic data in all different kinds of ways. And then county. So lots of different places to get information. So you have to kind of look at which one speaks to you. Which one do you understand? Which one works for you? Are you more of a visual person? Like seeing pictures? Do you have to read through things? You have to take notes. So you kind of have to figure out which one works for you. And I will go back and make sure that that those links work. We looked at that. Because it looked like this one didn't work. And oh yeah, that one doesn't have. This is a good, okay. Yep, I will fix those. And so we'll go back home. And I believe that should do it. So please reach out if you have questions. You can reply to the Welcome to Week 3 announcement. You can message me. Let me stop sharing. A lot of information. The other thing that I'm going to do is, now that we're getting to this data piece, I'm going to, I will record how to work on your capstone. So I'll throw in some information about the journal as well as your community organizing and advocacy project, I guess, if you will. And so I will post that this week as well. So I hope you have a good week, and this was helped you figure out what you need to do for the week. So have a great week, and I will stop the recording and see you online this week.